Today I'm talking about colorectal cancer and colonoscopy screening. And this comes at the moment, particularly the death of Black Panther star Chadwick Boseman. As a result of that, there's a lot of focus going on colorectal cancer and particularly colorectal cancer in the young. Well, first off, colon cancer is actually a very preventable cancer, and that's because it's often easily detectable on the colonoscopy. And polyps, which are often the precursors for cancer development, are also often detected at the same time during a colonoscopy. Now, the symptoms of colorectal cancer can be fairly varied, but there are a few major ones, namely, firstly, bleeding from the bottom when you pass motion, particularly if it's fresh, painless bleeding. That often is the first sign that you should be seeking medical consult, and this is irregardless of whether you are still fairly young or whether you are at an older age group. Now, the second symptom of colorectal cancer that can be a little bit worrying is referring to a change in bowel habits. Now, when we talk about change in bowel habits, we're not talking about having diarrhea for 2 to 3 days, but I think more importantly, we're talking about a persistent and consistent change in the movement of your bowels, and that goes on for a number of months. And then that's another worrying symptom. Other symptoms that might be also a little bit worrying include abdominal pain in the same location for a sustained period of time, and lastly, a personal or family history of colorectal cancer. Surveillance of the colon and colonoscopy screening essentially is easily carried out. The colonoscopy is actually a camera test that involves putting a long scope up the bottom, and that allows us in turn to do biopsies and also to take out polyps, all of which are precursors to colorectal cancer. And by keeping to a regular regime of colonoscopy screening, you will find that you will be able to reduce the incidence of colorectal cancer to a very much lower level. Colorectal cancer is something that's very close to my heart, and I strongly believe that colorectal cancer is easily preventable with regular colonoscopy surveillance. Now, with that in mind, I also hope that in the days to come that more people will take up the approach of doing colonoscopy screening, and by doing so, reducing the number of cases of colorectal cancer that we see in Singapore.